For many years, the main measure used to assess how good an ambulance service is has been how quickly an ambulance gets to a patient, rather than all the other aspects of care they provide. The problem with this is, it's been a long time since the ambulance service has simply responded to all calls with an ambulance and just taken patients to the closest hospital. Nowadays, people call 999 for many different reasons and conditions. And in recognition of this, ambulance services in England have been changing how they work so that they can meet the needs of patients in the most appropriate way. This means taking some patients directly to specialist care, for example a heart attack patient to a specialist cardiac care centre. But for others, it may mean providing advice over the phone, care at home, or referring patients to the best service for their care, which may be their GP or pharmacist, for example. Of course, time is important, but focusing on how quickly an ambulance responds misses the complexity of what the ambulance service now does and tells us nothing about how good the actual care they give to patients is. That's where PhOEBE comes in. PhOEBE stands for Pre-Hospital Outcomes for Evidence-Based Evaluation. Before PhOEBE, there was a lack of information about what happens to patients after their ambulance service care. PhOEBE has found ways to create better information, which can be used to measure how well ambulance services are doing. This has the potential to improve a patient's quality of care and overall experience. The PhOEBE project has worked with a range of experts, paramedics, researchers, NHS managers, policymakers, patient representatives, and members of the public to identify and prioritise issues they consider most important. For example, our team's patient and public advisors said the way the ambulance service manages pain is important and makes a big difference to the experience of every patient. Because of PhOEBE, ambulance services, patients and members of the public will be able to see how well they are doing at managing pain and if it could be improved. The pain measure is just one of a range of measurements developed by the PhOEBE project. These measurements will help ambulance services to assess how well they are doing in all aspects of the care they offer. They will also provide a way to see if changes and innovations are working. In the future, this will help services to keep improving so they can provide high-quality care and a good experience for everyone who calls the ambulance service. To stay up to date with the PhOEBE project, head to www.sheffield.ac.uk/PhOEBE.